identified the fact they were registered nurses in another country, and just over half were in a 6 to 8 month program studying to become personal support workers. So you have an interesting mix here of those who are kind of, this is the field that they are destined to be in, but the kind of quarter of individuals who are actually a nurse in another country is an interesting population to consider. Next slide, please. During COVID-19, the work experiences of the people that we sampled was interesting. Over half had an increase in pay. This was one of the important things that became apparent during COVID-19. And if you wanted to keep people working, the province also mandated a pay increase. 72% experienced an increase in working hours because there were many people, staff were leaving, people were getting ill, and so they were often short-staffed, and so there was a great demand for additional hours to be worked. More than 80% said their facilities were short-staffed and they experienced staff absenteeism. About 65% mentioned they were not satisfied with their current employment. So just to recap, to remember, during the first wave in Canada, there was a crisis in long-term care homes because of these issues: staff absenteeism, staff were short-handed, and in some cases, the Ontario government welcomed in the military. The military deployed medical teams to work in some of the worst affected long-term care facilities. So we're really talking about a very distressing work experience during that first wave of COVID-19 back in the spring of 2020. Next slide, please. The employer's experience was having struggles with retention. They found that very difficult. They were experiencing acute staff burnout. Employers had a number of vacancies on average every 3 months, so between 15 full-time and 19 part-time. So that's a lot of hiring that's going on during this kind of crisis period. The vacancies were mostly for personal support workers, followed by RNs and RPNs. They were mostly using job boards and websites, social media, and recruitment fairs. Even though they weren't being conducted in person, they were having sort of virtual recruitment fairs. They were actually, very few people were interested in the PSW work. I mean, they realised that it was at a very sort of acute end of the pandemic experience. Next slide, please. The employers engaged various retention strategies. This includes things like a flexible schedule, paid holiday, employee wellness plans, and they also recognised the importance of offering internal training opportunities, the idea of supporting some personal support workers to move into the registered practical nurse roles. And of course, this would be very important for those internationally educated nurses. They looked at increasing working hours and bridging programs to help home support workers. So those are individuals who are not working in the long-term care facilities, but in people's homes, helping them move into those personal support worker roles. And they did also allow temporary employees to apply for internal positions. So once somebody makes that kind of connection with the employer, they would try to find ways to keep them connected. Next slide, please. In terms of what was expected of personal support workers, they were expected to be motivated and hardworking, willingness to provide care, do different tasks. There was some expectation of what their training should be. And this included the focus on communication abilities and also coping abilities. So employers recognized the diversity of skills that are needed. I mean, this occupation is considered to be low paid, but sometimes this gets converted into the idea of being low skilled, which it's not. It's a very demanding position where you have to be able to manage the emotional and physical distress that your clients might be facing. You have to work to a very particular time schedule. You have to manage lots of clients at the same time. So there's a lot of demands within this job. Next slide, please. There was some focus on what was it that would keep people in these professions. And so obviously kind of salary is important, but, only slightly more important than things like career progression. and also working conditions. In terms of the perks of the job, if you can have the right kind of hours, that was deemed to be really important for people. And the decisions to actually go to work in the first place, salary, but also proximity to home and reputation. And so it's not all just about salary, but salary is certainly one of the key factors. Next slide, please. When we did the roundtable with employers, we asked them about their view of working with immigrant workers, and they recognise that they are a very important part of the personal support worker workforce, but they noted there are sometimes communication challenges. There was some concern about the variations in terms of the tests that are applied or the certification, the kind of training, because it's a non-regulated profession. There's a bit of variety in terms of the training that is available to personal support workers. In some cases, it was interesting that if students had come to, international students were in Canada and they were doing some kind of bridging program, they already had a nursing designation. As soon as they completed 1 year of study in Canada, some employers saw that as being adequate, that they had enough skills to work as a personal support worker. Some of the personal support workers do transition into some of these bridging programs to help complete their registered practical nurse certificate registration. And a lot of international students would be working part-time while they seek other employment. So in some ways, this experience is a useful one that can be taken up by an international student parallel to their training in programs of study, because they're getting exposure to the healthcare system, they're boosting their occupational specific communication skills. Next slide, please. So really, in terms of what this research was letting us know, it was helping us improve understanding of international students and newcomers and their experience in Canada. Also, the issue of looking at the reducing of the payment gaps between personal support workers in long-term care and home care. This came up as an issue. We need to find out strategies on reducing burnout, and we need to establish appropriate compensation, career development, and educational opportunities. All of these issues have been taken in hand by, in the case of Ontario, the provincial government, because they have started to think about registration, having a registration list for personal support workers, and enhancing employment conditions. Next slide, please. There are some certainly challenges and limitations. So we have actually completed this next phase where we were gathering quantitative data on temporary immigrants in southwestern Ontario who have occupational health training. What we found, though, is quite difficult to access that data because things like the census offer limited options. They're also subjected to privacy. There is what's called the Longitudinal Immigrant Database, which now includes temporary residents. As I mentioned at the beginning, we have far more temporary immigrants coming to Canada every year. This includes international students. And so we need to know about their experiences. That is being gathered, but it's not that easy to access that data as of yet. And there is data from the Canadian Institute of Health Information, but you have to pay for that. So we ended up paying money for some of that CIHI data, and we have a paper that we've submitted to Human Resources for Health Biomed Journal. Next slide, please. So in conclusion, the COVID-19 pandemic highlighted the workforce crisis in long-term care, not enough staff, poorly paid, non-standardized training, and we have increasingly become aware of the significant presence of immigrants in this sector, including temporary immigrants. Regional labour shortages were acute in southwestern Ontario, especially in rural areas. And what the Workforce Planning Board wanted to know was what's the potential labour supply when we take permanent and temporary immigrants into account, and we need to understand their diverse pathways into the sector. What we found is the workforce is primarily female, young, and they have diverse status in terms of their citizenship status. Employers are conscious of this diversity. They have developed strategies to try and attract and retain them, including training opportunities. Majority of workers were really not that satisfied with their current job, and they were suggesting they would seek other employment opportunities. This may have changed slightly, as I said, because the salary has increased and there has been a great deal of attention placed on the PSWs, recognising the significant work that they did during the pandemic and how essential they are. However, in some cases, policy decisions might exacerbate the issue because, for example, the Ontario government produced a personal support worker training fund, but this excluded those who had trained as nurses. And so the province was saying, well, this is for personal support workers, it's not for nurses. And in some cases, this would be a problem if they include internationally educated nurses, some of whom may decide to remain within the personal support worker field. And so there's potentially a policy gap there in terms of understanding the kind of how this policy might reinforce their transient status. So it would say, oh, because you're a nurse, you're not allowed to have this enhanced training as a personal support worker, when in fact that individual may have made that decision that they want to stay in the personal support field. Next slide, please. So there's the references, and then the final slide. Next slide, please. And thanks to all of those who've helped support the work. I hope if you have some questions. Thank you.
Thank you so much, Margaret. I think you have done on time. You took, my staff can close the PowerPoint. So now it's open for the comments and discussion. I see some people who are working on this area is here. Questions, clarification from anyone? Anyone want to have any comments? Because this is going to be a growing topic in many countries in the context of international student migration and the care workers. Any questions, any clarification? Sonia, yeah, please, Sonia.
Thank you so much. Actually, I am calling, I am in the typical Austrian healthcare system. Okay, so I'm in Vienna now. So I'm going to ask you that here we have got a very big questions about their own health issues of the health carers. Our country is very particular about it. They either should be vaccinated or otherwise they should have a PCR test to take care of their healthcare issues. Mm-hmm. And because they feel that the persons whom they are giving the healthcare is already very weak. So the persons who are giving the healthcare should be perfectly fit. So may I ask you, what is this sort of communication? Because we are facing, as you can see, Australia is already facing a lot of problems with a lot of things about vaccinations, about the healthcare, and there is a lot of humanity issues and humanity sort of thought problems. So I want to ask, what is Canada's thought in this process? Thank you so much.
Yeah, thank you for that. Thank you for that question. Personal support workers, the expectation is that they should be vaccinated. I think that I'm trying to remember, I think there was a mandatory vaccination order, but unless you had some kind of exemption, some verified exemption for why you shouldn't have a vaccine. And personal support workers and essential care workers and healthcare workers were all prioritized for receiving the vaccination. So at the very beginning, when we first had the vaccine available, those were often the first people vaccinated. So really, like in the spring of 2021, we saw that population getting vaccinated. So here in Canada, the expectation is, healthcare workers should be vaccinated. We've had some, I think probably we're looking at sort of in the 90% range in terms of vaccination rates. We have had some issues of healthcare workers who have not got vaccinated, and this has been dealt with differently at each provincial level because the province manages the healthcare system. So in Quebec, they have released those workers who did not, who refused to get vaccinated. And of course, this adds to an already acute labour shortage. And in Ontario, I believe, because this is sort of a changing dynamic field at the moment, but in Ontario, I think what we had is an expectation of people getting tested. So I don't think there's some dispute between the government and the healthcare sector in terms of how to respond to this. So it is a complicated issue, but the majority, I would say 90% plus of those workers have been vaccinated and were in fact prioritized for those vaccinations. And in Canada, for example, international students are able to get the vaccine. And so they are part of the population that public health is responsible for vaccinating along with everyone else.
I just want to ask one more question, and I've been here in Athens. Suppose in Italy and in Greece, people are being temporarily laid off if they are not vaccinated. Of course, Austria has not done anything like that. Germany has not yet done anything like that. So is there any issue of layoff there, or no? You are just motivating it. There
is, I think, in Quebec that is what's happened. And so if I remember, possibly around 500 healthcare workers have been laid off or are temporarily, away, not working because of this issue.
Thank you so much.
But I think that's a very important thing, because vaccination is something, because Margaret, that when we talk about health worker given priority, are you sure that the students were also given priority? Because in India, migrants were not given priority in the initial period of vaccination.
If a person is working as a frontline worker, they were allowed to have the vaccine. And I know in our public health region, international students are being vaccinated along with everyone else. So it's not like Germany, because I know in Germany they were not vaccinating their kind of immigrant and undocumented populations, but in Canada, my understanding is that we have been vaccinated. Public health units are vaccinating everyone in their region.
No, here I want to add also, later part in Germany and in Austria, what is happening is that due to stop this COVID in spread, in the later stage, in the second phase, they were all being allowed to get vaccinated this out of this humanity ground when this World Health Organization and the UN came in it. Of course, the rate is slow, but it started working there. And I think Canada and all those have started much earlier. And your city-wise lockdown is also working very well, because each city has got a sort of a federal structure.
Mm-hmm.
Okay. Any other questions, clarifications from anyone else? Divya Balan, I can see you. Divya Balan, you have any questions? Because you work closely on gender. Divya? Okay, I just called Divya anyway. I thought she may be asking some question on, because she works on gender. Any other person? Anyone? Since they are all clear about what you spoke, probably. Very silent crowd, anyway.
If people have interests in questions just more generally about international students, I'm happy to talk about that as well, because here in Canada, there's been a lot of discussion about international students, as you know. So we have a lot of, many international students coming from India. And we've had issues with regards to their protection during COVID-19 and their experiences. And so that's certainly been of interest. And then also in response to Sukarna's question earlier, there has been some interesting research done on actually the health of international students themselves, especially those coming from India. And I recently heard a presentation by two doctors who've been doing a project where they're working with international students from India with regards to their health issues. And what they found is quite interesting in terms of the different kind of health problems that are presented by students from India. So, for example, they found a very high rate of anemia in the young women that they see. And they also find a lot of untreated conditions that for some reason individuals did not want to have dealt with when they were in India. But then once they come to Canada, they're open to having like reproductive gynecological issues kind of dealt with. And so this is very interesting in terms of the health profile of this population, and especially when we understand how much they are integrated into the health and care sector as workers. And so having a recognition of those differential healthcare needs as well is really important for the kind of protection of that population too.
And Margaret, along with that, because I was also told, because most of the students who came during the COVID-19, they also had difficulty in studies because most of them are online, as well as that they also had problems in some type of psychological stress because they could not meet their friends. Everything was locked down. So probably psychological stress, I don't know, because I was talking to somebody, even anybody committed suicide. For example, I was talking to some returned migrants who came back. I was in Bihar last week. They tell some people committed even suicide. So I don't know any students, some suicidal tendencies, because nobody's there, because they came and they were stuck immediately. They got no money, and they were thinking, I was told some people, they were thinking they will do some work. They would not get work also, because they are not able to do some work. They have no money at all. I was told even there's a big problem of even starvation among some of the Indian students in UK. Someone told me and reported to me. So,
I've read about the UK experience too. And in Canada, we've had a number of reports in the media from, for example, funeral directors who are just saying, like, I'm dealing with these international students who died because of suicide, because they're isolated, they're lonely, they're anxious, they don't have their supports in place. There's pressure. I mean, there's pressure as an international student. It's as an international student at the best of times, you have to face all kinds of issues around food and familiarizing yourself with your community, finding money, finding work, coordinating the timing of your studies, with the ability to find work, to get your visa. So there's immense pressure at the best of times. And so COVID-19 disrupted a lot of it, as you said, Rajan, because people were isolated. They didn't have the same kinds of social support networks. There was a issue in terms of some of the work that may have been available. Some of the jobs, contracted, but then the jobs that were available were very much frontline in the service, in the delivery. And so then there's this constant exposure to COVID-19 as well. So yes, you're right, there is some concern. And in response, I think what's happened in response is that colleges and universities in particular have recognized that they must step up in terms of the services that they provide. And we are seeing that. I know at my own institution, they've instigated an international student work experience plan, so students can apply and get work in the university and be paid. Other universities and colleges have recognized that they need to provide better kind of health monitoring, better supports. I think the federal government has also recognized that they should perhaps be providing more services to international students, because in the past, international students didn't qualify because they were not kind of permanent residents, so they didn't necessarily qualify for language classes or workplace supports. That, I think, is being reviewed. I think there's some kind of because the recognition is that between 30 and 50% of international students are understood to transition to permanent residence. And so over a period of 5 or 10 years, right? So they go through different kinds of visas, but eventually the plan is to try and become a permanent resident. So if you're introducing this population that you think will provide immigrants in the long run, then really you should be assisting them at the very beginning as much as you can in order that they have a successful settlement experience. And so I think that's becoming more and more apparent to policymakers. So we may hopefully see more changes to enhancing the supports for that population, because you're right, Rajan, there's been a lot of media reports about the acute stress that they've experienced.
And I'm not sharing any hands right now to ask. I just wanted to also follow it up on that, because many students, like I was looking at it, a lot of people take also loans and come. Of course, the long-term trend will be they want to become citizens. You all looked at Punjab several years back on how much they invest to come to especially English-speaking countries, not to Austria anyway. Sonia, but the English-speaking countries like UK, Canada, Australia, New Zealand, we know that. I myself have seen in all these countries. But the point is that they have put the money to send their children there, hoping that they'll get the whatever called green card or this thing. But then that money which they put a big investment, and they could not make any money during COVID-19 because there was no work available. So I think that also might have, the back home, there may be a lot of issues in the family itself, because a decision to send a boy or a girl to higher studies, and of course in the disguise of long-term, PR, which that in Canada, in Punjab, they are ready to spend even 1 crore to get a student visa. So I think there is also some type of problem in the countries of origin. Did you come across anybody reporting that now, I'm not able to neither eat myself, I have to get money, the COVID-19, we also see a lot of backward remittances. The people were sent, even from Kerala, money went to Gulf to support the migrants because they have no job, they have not got salaries. And even send money to pick up the Vande Bharat flights, which came to India. So like that, you saw that lot of fourth, and I don't know, I just was thinking about it because we are also currently taking up a study on Indian students in Canada, part of the SSHRC project with what is called that our university where I work closely, that Ryerson, there is a project coming up. So I think this is also there because there is a decision, they put a lot of money, but they are not able to either recover, not happening, things like that. There may be a stress even back at home.
Yeah, there was some evidence of that in the reports that came out in, like, the Walrus is a magazine that published a very long report, and the Globe and Mail. And there, what they found is sometimes those individual students were immensely stressed because they acknowledged that their families had invested so much in their ability to come, and they were expecting to be able to earn money or to transition to become a permanent resident, and the burden of that expectation was part of what was causing them all of this anxiety and stress. And so that relationship is also part of it. But the other thing, I think sometimes, when you are feeling acute stress yourself, who do you get to talk to? I mean, your family and your friends, your kin are the people that you would normally want to talk to about those things. Well, in a situation where your family is perhaps expecting that you will succeed, that you will eventually become a permanent resident, that you will make some money, you don't necessarily want to tell them that things are not going well. So that really important support structure that, most people normally rely on becomes a very difficult, you can't use it for that purpose. And so you have to be very careful about how you present the situation you're living through. And if you don't have any other kind of support system where you can relay that information, then you really are isolated and you're struggling to manage that. And so I think for some international students, that's what they tell us. We say, do you talk to your parents about this? And they're like, no, I don't want my parents to know that I'm struggling because they have invested so much in me. I have to be successful. I can't tell them this. So really, that is a problem. That is an enormous, that kind of anxiety that it induces is become very worrisome.
Okay, so we have the last question by Sonia, and then we will wind up the program. Sonia, you are the last one.
One question I want to ask: what is about, like in Europe, we have got a different health insurance set up for the international students. Okay, and in many cases, this health insurance, of course, there is a concept of what Professor Rajan said is that at reverse remittance is of course working there because you have to send money to bring them back. Okay, so what is the health insurance means Canada government is giving, or is it a form? It's a uniform one, or is it depends on the federal structure?
Again, health is a provincial matter, and so your health card is issued by the province. For international students, they have access to health insurance, like certain basic things are covered, but they do have to have health insurance. And sometimes through the universities, there's a mandated health insurance that's paid through the universities as well. So yes, they do have to have health insurance, and it differs according to the province that they're in.
Thank you so much.
Thank you so much. I think if there is no question, probably I would like to take this opportunity to thank Margaret taking her time. Of course, this is a early morning for her, and we have night now. What time right now, Margaret?
It is 10 o'clock in the morning and it's snowing outside.
Okay. So taking some time to talk to our group, and we will be in touch with you. Probably if you can write this, what you have spoke, probably we can also put as a EMR working paper for the wider audience. Then you can also publish wherever you want in the journal later. Maybe it is possible. We would like to have your speech written and put it in the EMR working paper. Okay. Thank you.
Okay,
thank you very much. Yeah. Thank you very much, everyone. Thank you. Bye-bye.
Have a lovely day. Bye-bye.
Thank you. Thank you.
Thank you so much. Bye-bye.
Thank you.